started actually much earlier during the apartheid time, although that time it was, of course, according to apartheid. I've also mentioned that our ministry is actually given this task of coordinating the programs around government in terms of poverty eradication. I've talked a lot already on what is poverty. We have that conjunctural poverty, which is caused by natural hazards. If you have HIV come and kills a lot of people, that's a natural hazard. If we have a cattle disease like the rinderpest, that's a natural hazard. But we also have the structural one, which are caused by underlying disabled factors, which are social and natural endowments, which undermine agency and resilience. So structural poverty, especially before in pre-colonial Africa, it was related to people who did not have access to labor. These are the weak individuals, and I think our social welfare takes care of that. We look at weak individuals, we look at disabled people, we look at the young people with people who are not, with parents who are not in employment, and government gives grants to those people. But we also have conjunctural poverty, which has caused this form of poverty is climatic, but it's also political. And it causes mass famine and mortality. It was moments of this that if you are excluded from resource, that your poverty really deepens. This slide is just talking about history, how people have survived poverty. Ethiopia is actually a good example where it's written a lot on it, and Europe also has a good history on how, I mean, for decades, because of they wrote much earlier than most of us. In Ethiopia, they didn't have any institution which were created to care for the poor. But in poverty, I mean, in Europe, they had this system already of institutions taking care of the poor. But in the rest of Africa, and it's not only pre-colonial times, even now, myself, if you see how many people I take care of, I think in South Africa they call it black tax. Besides the social grants from government, all of us have to take care of our relatives. And we call it, we are our brother's keeper. You must know that your brother is okay. You cannot just ignore that he's not okay. Even if you had the same level of education or you all went to school but he didn't manage to finish, you have to take care of him and his family. So that black tax, that's why when I heard about solidarity tax, I mean, I was quite surprised that I think as we have a lot of it already ourselves. We do a lot of solidarity tax by taking care of our families. Yeah, by definition, I don't think I will dwell on that a lot. I think the most important one is this one, just to say in Namibia, especially for our ministry, what we consider the poverty lines. The upper one, we consider people poor, and this is actually pegged to a financial amount that if you only live on $500 per month, that's the upper limit, and the lower limit is $290. You are considered very poor. That's the poverty trends. I'm also struggling to see that one. Yeah, we'll just get to the slides later. If you look at I think although we are showing it in figures, which are done by our NSA, we already know that there's an urban-rural divide when it comes to poverty. Being higher in the rural areas as compared to the urban areas. And that's not only food, but if you look at all the other sanitation, all the basic needs which are needed, housing, everything is not so good in rural areas. No wonder all of us are running away from that. As beautiful as the area is, but it's so difficult. I remember when I had to put my my own house in my village, how much it costs just for you to get water, how much it costs for you to get your own electricity. And there's no subsidy. You have to pay NORAD the amount which you need to make sure that you get electricity. And if without it, I think all of us are getting very comfortable in town. If you go to the rural areas and start using the bush, you don't stay there, you run away very, very quickly. I've already spoken about the Gini coefficient and how it has moved. Inequality by region, I think these are well-known statistical issue. So just coming to why eradicating poverty and redistribute wealth, I think my speakers before me were very weary of redistributing wealth as a measure, but for me, I'm a stand believer in it. And the reason I say I'm a stand believer in it is that I always ask the question that if fishing rights or mining rights, all these resources, what makes another Namibian qualify more than another Namibian? Why should one person get more of it than the other ones? That's really the question. How do you choose? Even when we're giving, if you give farms, we're having this land, and it's quite an issue that you have to choose between two people who gets it. But these are the resources. In Namibia, we depend on natural resources. So whoever has them in their hands, they're the better off. Whoever is not in that scenario has nothing. That's why I find wealth redistribution is a very important thing. But of course, we have challenges of low population density, especially for the rural areas. If you want to put up electricity, we have vast areas to cover. But again, I think we are a country with vast natural resources that if we focus, we should be able to cover 2 million people. Unemployment is very high. I think our current figures should be 28%, if I'm not mistaken. I'm right, huh? The people who know the labor figures quickly in the room. We have high unemployment, and this is one of the subjects we've been discussing as an issue for social protection. What do we do? Because our social protection actually covers people from children up to 18 years old. Then they are no longer covered. And then from 18 to 59, if you don't have a job, you don't have a business, you have done anything, you don't receive any assistance. And you only get assistance from government when you are above 60, that's 1,250. So we still have that issue that it's well known that we are not creating jobs enough. And if you look at the global economy right now, I don't know, it's very capital intensive. People are making robots which will do the job of a human being. So are we really going to create enough employment? And if we are not creating enough employment, then what are we going to do? That's the question we've been asking. Because the trend is that this issue of having mass jobs, even in agriculture, when tractors arrived, all the labor was laid off. So you don't need labor anymore because a tractor will do the job of. Then we have now even harvesting. There's a lot of harvesters. You don't need that kind of labor. It goes to technology. When telecoms changed everything, it means more and more people are losing jobs. So we can talk about, I always find that one a very big contrast that we talk about job creation, but the truth is that the globalization and all is going towards low involvement of people, more mechanization. So we have to introspect on that one, that's how we really create the jobs if the whole trend is going towards low involvement of people. Urbanization also is an issue that we want to reduce because it's creating all these informal settlements, but also we know that's a fight we are not going to win. As I said, if you are sitting somewhere without sanitation, without electricity, with bad schools, no health. I remember even myself, I was working in the Zambezi, and their health is difficult. There's no no hospitals which are properly equipped. So if your son is sick and he just needs intravenous, you are running around, nobody can do it. So will you choose to be in that place or not be in that place? So these are personal choices, but they affect urbanization, that I cannot be in a place where I don't get services. I'd rather go to where there are services. So the challenge of relating to basic services, water, sanitation, all these issues, even education, if you are just situated in a particular place, all these basic services, you'll not get them. So how can we can't stop urbanization unless we do something about that. And also improving food security and nutrition. That's an issue. I think if we had people from health, they would talk about below 5 child mortality. It's still a concern in Namibia. It's still very high. And part of it is nutrition, which we have to look at. Namibia, every day we are talking about gender-based violence. It's quite an issue which affects us. The social fiber of this nation, that you wake up, innocent children are dead, baby dumping, all these issues are real ones. And another one which is also close to my heart is the issue of alcohol abuse and drug abuse. And this one, I talk about it in a context that we are a nation where our socialization right now, from very young age, is to expose young people to alcohol and drug abuse. And I say this because I am coming from the rural areas, especially in my village. If you look around at what the young people have in terms of socializing them, there's nothing. The only thing which will be sitting in a village is a shabin with a DSTV and gambling machine and alcohol. So every evening, and these are even next to schools. This is the structure of the Namibians, and I'm not talking only rural areas. It's the same story if you go to the informal settlement. These days, not even informal settlement, even as close as Rocky Crest. You'll find corner shabins with gambling machines, and that's where our kids are socializing. We have no amenities made to keep the youth engaged. The cultural plays we used to have before are no longer connected to schools. All these issues determine, I think the lady from UNICEF was talking about starting early. But we are starting early with alcohol abuse. That's the path you are put on from the young age. And when we are big enough, like my age, I would just say that, no, it's a business. It doesn't occur to me that this actually affects the social fiber of our nation if we start our people like this. Director of Ceremony, I hope I'm not out of time. 3. Okay. But I think I've said a lot already. Just the ministry also, it's been in existence for 3 years. Of course, social welfare has been around much longer. Since that 3 years, we made efforts to produce 2 very important documents. One is the blueprint on wealth distribution, and one is the zero hunger. The blueprint is just a policy framework.